Okay, so as we finish up our coffee and everyone's taking their seats, let me tell you that the third panel is on enabling environments. So we've heard so much today about data, we've heard about trust, and now we're going to hear about streamlining regulation for innovation. So we're really lucky today. We're going to have 2 keynotes, and then we're going to move into a panel discussion. And I'd like to invite Professor Christoph Straub, who's the CEO of BARMER, to come and give the first presentation, and those who are still finishing their coffee.
So once you're seated, I will start. I don't want to rush the people to their seats. Yeah, distinguished guests, ladies and gentlemen, and all dear listeners who are joining us today from their computers and mobile devices. It's indeed a pleasure for me to take part in this four-sided panel and exchange knowledge, insights, and practical experience with our friend from Israel. I would like to start by describing briefly the current state of digitalization in the German healthcare system, in particular statutory health insurance, where I'm from, and present with you an innovative digital example. On an international level, the German healthcare system is lagging behind in the area of digitalization. Many of the advantages of digital technologies are not yet universally offered across Germany, while remote patient monitoring, the use of artificial intelligence, and electronic patient records have long been the standard in other countries such as Israel. The corona pandemic has highlighted the real need for digital advancement in the German healthcare system. Compared with other countries, Germany has very well standardized health data, even digitalized data. But the data are not sampled, stored, and accessible for comprehensive analysis. Since the corona pandemic, Germany has been dependent on international data, for example, data on the effectiveness of new vaccines, and thus important political decisions have been made on the basis of international data rather than national data. However, in this legislative period, Germany has also laid the digital foundation for healthcare and has started to catch up. But we have to be honest with ourselves. There are still a lot of challenges to overcome. In saying that, I would like to give you some examples. First, Germany is the first country in the world to prescribe digital apps, DiGAs as we call them, which means digital health application, and reimburse these through statutory health insurance. It is one of the most popular and best known projects of Federal Minister of Health Jens Spahn. There are currently 20 DiGAs on the market, and the prices range from 119 euros until 567 euros for 90 days, which is far more than is paid for medical treatment by doctors. The prescription of digital apps needs further practice-oriented development. For example, statutory health insurance needs evidence that a health app is actually being used. Therefore, in the future, reimbursement of digital health apps must be linked to active usage. Second, the German telematics infrastructure was created to connect all players in the healthcare system and to ensure the secure exchange of information across sectors and systems. It is a closed, safe, and certified network where only registered users have access. However, as a part of the nationwide rollout of the telematic infrastructure, not all service providers are connected yet, and we are still waiting for the option to use instant messaging to communicate easily with our insured persons. Statutory health insurance needs the fast connectivity of all service providers to the telematics infrastructure and operational applications. Third, statutory health insurance has been offering electronic patient records since January 2021. Only if all physicians, hospitals, and other service providers can store data in the electronic patient record can this digital application show its many advantages. But as I have already mentioned, not all service providers are connected to the telematics infrastructure, the technical link to the electronic patient record, and only about 200,000 accounts have been created voluntarily by now. Therefore, we must publicly discuss whether all patients will receive an electronic patient record either through birth or through moving to Germany, which means an opt-out model. Furthermore, the European General Data Protection Regulation offers a scope that must also be actively used in Germany. Data protection in Germany must allow an optimal medical care for patients. There has to be a better balance of data protection and use of data in the patient's best interest. Fourth, Germany has a lot of catching up to do in terms of the degree of digitalization of hospital IT. Therefore, the German government created a Hospital Future Fund in 2020 with the aim to support investments in digital infrastructure and information technology at hospitals. The fund comprises of a total of 4.3 billion euro, 3 billion euro from the federal government and 1.3 billion euro from the 16 German federal states. Feedback from the states shows that almost all hospitals have reported demand and the allocated budgets will be fully used. But it's important to mention that the funding must be provided independently of a structural debate. Germany urgently needs a structural reform of the hospital sector. Last but not least, in January 2022, the e-prescription will be officially introduced and become mandatory. Now, pilot regions in Berlin and Brandenburg are testing the introduction of the e-prescription under real conditions, but several service providers still have some technical problems that have to be solved by the end of the year. And it must be possible for statutory health insurers to integrate this e-prescription application into our service applications. Our digital environment in healthcare must be simple and intuitively usable for patients. In part 2 of my speech, and it's a very short part, I would like to present you with an innovative digital example of BARMER, the second largest statutory health insurance in Germany with about 8.8 million insured persons. German statutory health insurance also actively promote digital innovations as digitalization means competition and differentiation from competitors. BARMER was quick and early to recognize the many opportunities offered by digitalization. Despite strong resistance, we pushed through a model project and announced in 2016 our investment of 15 million euro in the venture capital fund named Early Bird Health Fund for a period of 10 years. We identified several advantages to invest in this venture capital, such as gaining insights related to health technology innovation, recognition of potentials for an improvement and further development of healthcare, and broadening the focus of international developments. And we succeeded. We received a special permit for the cooperation with the Early Bird Health Fund in 2016 and laid the foundation for the German Digital Healthcare Act of December 2019. With this act, all German statutory health insurance funds are now able to promote the development of digital innovations by providing targeted funding for good ideas and participating in venture capital funds that specialize in health innovation. Thank you for your time.
Professor Straub, thanks very much. So many more ideas there that we unbelievably haven't yet covered: electronic prescribing, prescription of apps. So I'm going to ask you to take your seat for a few moments while we hear our next keynote, which is from Mr. Yoel Ben-Or. So Yoel's from the Head of Policy at the Digital Health Department, Ministry of Health, Israel. Yoel, please.
Okay, that works. Well, thank you very much for inviting me. I want to thank my colleague, Dr. Ludwig from the Ministry of Health and his team for starting this exciting collaboration, and ELNET, of course. Since we're starting, I thought it would be very good to have a wide presentation about the challenges we're facing, what is on our table these days. Last panels, we heard a lot about how Israel is advanced, but I'm getting paid to try to fix problems, so I will talk more about our problems, and I think they will be very familiar to you, I guess. So when we think on AI in healthcare, I would like to distinguish between two main baskets of challenges. One, of course, is data accessibility. If you can't access quality, diversified, sometimes coming from different health systems, different IT systems, it's very hard to deploy AI. And of course, you need to do it while maintaining privacy. But let's say you encounter these problems, and now you have a nice AI algorithm. It still doesn't mean that it would be deployed in wide adoption in clinical settings. So let's start with the first point. So when we talk about data accessibility, we like to divide it in 4 elements. The quality part, which, as was mentioned before, Israel has rich data sets that we're very proud of, but the fact that we started early means that we are in a mess when we speak on coding system and modern terminology. And in the next years, we plan to invest much in transforming the system to SNOMED CT. And there's a broad consensus in the health organization, the ecosystem, that's a very important step. But we have a small problem. When we talk to managers in the health system, they say, look, this is a great step. It's very important. Please start it after I retire. So we understand that we need to have strict regulation that will be part of this project if you want to see wide adoption in SNOMED in Israel. When we speak on diversifying the data, then we take a decentralized approach. We think that competition between health organizations is a driving force for innovation. But these are public entities, and if we want them to collaborate with industry and academy, we need to invest and help them to put the infrastructure. And we do that with competitive grants. Actually, it's an exciting day because we just announced a new model for giving these grants in Israel. And we see more and more health organizations coming to the playground and trying to collaborate with industry. But competition has also its limits, especially if you need to have an AI algorithm that is running across different health organizations. You need them to collaborate. Then if they're competing all the time, that can be a trouble. And I hope that the pandemic gave us a push towards the collaboration, to move the needle towards the collaboration. So I hope we'll see some advancing in this field. If we go to privacy, then also the decentralized approach is in place. We are relying mostly on local IRB committees in health organizations to take the decisions. And I think that this system works quite well. And if we want it to work better, then I think the missing part is more concrete guidance about anonymization techniques and best practice for dealing with privacy, because these committees are regularly dealing with clinical trials, and when they come to approve big data research, some of them needs more guidance of best practices. And the last part is interoperability, and this is the one I like the best, so I have 2 slides on this. So if we look into interoperability in Israel, then it was mentioned before, we have a very impressive central exchange system between hospitals and HMOs. But when we look at the future of the ecosystem, and actually not the future is already here, it's becoming much more decentralized with much more players and much more consumers and suppliers of data. And if we want them to interact with each other, and we want AI algorithm to interact with all the nodes in the circles, we have to have a move between a centralized mechanism to an open standard data exchange that will enable us really to foster interoperability in the system. And the question, if there's no central permission management, then this raises a lot of questions, but one of them, if there's no central permission management, who will control the permissions? And I think that putting the patient, letting them also decide, and if I'm referring to the last panel, I don't think they're the only one who needs to decide, but letting them also the ability to decide could be a game changer. And obviously, this is not a technical debate of which permission system is more efficient. This is a debate about the future of medicine, of how we are empowering patients, how balancing between innovation and privacy. And I'm sure that this debate will be on the agenda of many, many countries, especially after the US regulation in this domain. And I think one of our challenges together to try to find the proper regulation that is different from the US regulation, because Israel and Germany have different attitudes towards privacy. So I think this is a challenge that we both have. But we're not waiting to answer all the questions of this debate. We try to start with the technical stuff, and I'm not going to be technical, but the FHIR standard is the one who's enabling this vision of open standard data exchange. And we started last year with very exciting, small but exciting use cases. And we really hope that 2022 will be a scale-up year in implementing FHIR in Israel, and we're trying to invest a lot of money in it, while having the debate of permissions and empowering patients along these lines. So, okay, we solved all the data accessibility problems. Now we have an AI algorithm that can run in the market. But still, there's a bunch of other questions of trying to deploy it in clinical settings. And I think the first thing that is worth mentioning it, nobody forbids them to run in the ecosystem, and we actually are seeing an increasing implementation in the Israeli ecosystem in a lot of domains. I didn't want to put here logos of company, but in every one of these domains, you can see more than one company working in Israel, and in other domains too. But that doesn't mean that there's no open questions. And just wanted to give some examples. I'm not going to try and answer these questions. I think these are open questions. And the question, do we need to adjust our software as a medical device to adjust to AI algorithms that keep changing all the time? Do we need different funding mechanisms? The DIGA model is very, very interesting from our perspective to learn from. And privacy and security. Today, the risk management is something done by health organization. I think maybe we need to think of helping them doing that and doing some kind of a central accreditation mechanism. And there's a lot of other questions. But I want to finish with maybe one question that is relevant to all of these questions, and it's a question of when is the right time to answer these questions. And I like this quote of the mayor of Pittsburgh. Pittsburgh became a playground for autonomous vehicles in the past years, stating that, with the agenda led by the mayor, stating that innovation never comes first. Unfortunately, I disagree with him. I could work less hard if I was completely agreeing with this statement. I think sometimes regulation needs to come first. If you want to create new markets and you have trust in the market between all the players, it's very important to have regulation in place, but not to all the questions. I think one of the challenges is to distinguish between the questions it's important to answer now and the question that it's okay to learn first, see what are the shortcomings, and then act. So with this, I'll end. Thank you.
Fantastic, thanks so much. So I think this is the focus of our next panel discussion. What do we need to answer now in terms of these questions, and what can we wait a bit? So how do we create this enabling environment? So I'm going to ask Professor Straub to come back to the podium. I'm going to invite Limor, Shmerling, Magazanik to come to the stage, and Professor Karl Broich to come as well. So here are your panel. I need to sit in the right chair this time, the one. Doesn't matter as long as I give you the microphone, basically. Okay. So first of all, Professor Broich, can I come to you? So one of the questions there was about what do the standards that we currently have in terms of regulation for AI products or digital products apply directly as they are, or are changes required? So what's BfArM's thoughts on this?
Yeah, thank you very much for this question. And I think we have to adapt here to the future. So there are no standards available now. And I think the difference we heard today several times is for the time being, we are risk avoiding, looking to these developments here in Germany very much. And we are very restrictive in the past, or have been very restrictive. But we are looking forward now to these new approaches, and particularly interoperability, standardization will be key to these new techniques, how we can use them. And so we started already with this no MedCT area now here in Germany, and we are pushing that from the BfArM side. And I think this is a pre-requirement when we are thinking in these developments.
Super interesting. So Ms. Shmerling, Magazanik, if I can come to you. You recently completed some research looking at secondary use of health data research. I wonder if I could ask you, in general, what the findings were, but then specifically what happens in Israel.
Yeah, sure. Thank you. So I think this question is also very timely after the previous presentations, because I want to focus for a minute on the issue of consent as a legal basis for the secondary use of data. And I'll say that we conducted a survey of 8 governments' evolving national policies for the secondary use of health data for research, which allows both industry and academia to access the data, and also includes safeguards, various types of safeguards for privacy. And the first thing that's interesting to learn is that consent or patient consent is not the basis for this. So, and the General Data Protection Regulation in the EU allows for other legal bases for processing of data. So one of them would be scientific research, and another would be public interest, relying on a member state law. And we've seen nations creating these laws, for example, Finland, France, Ireland, there's also in Australia, and this is part of what Israel did and Yoel worked hard at. And all of these governments have created specific laws that indicate or that empower health organizations and industry and academia to access and share data for research not based on consent. And that is an idea that is, I think, requires some processing for people. One, because for the medical profession, relying on ethical boards and clinical trials and interventional studies having to do with the physical body, consent is very primary to the process. But for data ethics and data governance and ethic boards that have data professionals in them, consent is not necessarily the basis. And it also has an impact on data inclusivity and our wish and goal to have people and population represented in research. It's also been acknowledged by bioethicists that being included in research and in the benefits of research is a part of our human right to health. And if we rely only on consent, we may have skewed the data because not all populations will be well informed enough or wish to participate. So for all of these reasons, these regulations have been put in place in all of these governments, and this is recently from 2019, just before COVID, and it all was inspired by OECD guidelines to the same effect. Now, the findings specifically show variance. So even though there's a commonality between the basics and the principles of these regulations. So for example, the process of the ethical boards, the process of distinguishing what is a recognized public interest for research, those differ between countries. Also, the identification, how is that defined and what does that mean for data? How much is enough? How much, because we know there's not 100% anonymization, but how much is enough in order to allow us to proceed and consider this safeguarded enough for privacy and data protection? There are also issues of data localization. So some governments require these laws, and this has to do with the fears and risks of privacy, that the data processing will be within its borders or will be only by local entities, legal entities. And thinking about international cooperation around data research and health data research, that may be a challenge. So all of these interesting findings arose in this research.
It's really interesting. So thinking about Israel specifically, is Israel broadly in line with the other countries that you looked at, or is there something different about Israel and the use of secondary health data that makes it a more permissive environment?
I think that in Israel, there's already in place a system that has been working in health organizations with the IRBs, with the boards that function within the health organizations, and a general regulation, a circular by the Ministry of Health that allows for the use of data for research. And there's a law from quite a few years ago, I think 15, that allows for data research. So there is a regulation in place. that is not old, but oldish, and the system is working. So the Ministry of Health have introduced a draft that is more advanced, that allows for even more players to come into the game, that is more up to date with the current privacy and security requirements. But we do have a system that is functioning. So it's a question of timing.
Super interesting. Okay, so now I'm going to come to each of the panel with the same question. We've heard a lot about barriers, about potential problems, about maybe issues, but what I'd like to ask in this panel, which is on an enabling environment. So given your position, given your knowledge, given your expertise, what are you working on right now that you think is going to change things, ideally in the next 12 months? Like, what's the roadblock that you're working on lifting? And is there anything else you would like to ask others to do in order to support you? So I'm going to come first to you, Mr. Benor, for that one.
Well, 12 months in health system is ambitious if you're talking on IT systems. But I talked about it. I think FHIR implementation in Israel is a game changer. And I think all around the world. And I think if I would need to put something in first priority, this is what I would do, trying to make as much as possible the EHRs and the vendors more open with open standards in the system.
Okay, so tell us a bit more about this. You mentioned the FHIR standards, but one of the things that has surprised me throughout the day is, okay, yes, we have this idea that Israel is ahead, but one of the problems that you're having because of having a system which is already built is that you're updating things. You referred to this yourself, you know, do it when I retire. So what difference will this make given the capabilities that Israel already has?
Well, I think this is a hard argument in Israel because when we try to convince people, look, you need to invest in FHIR and open standards, we say, but we're okay. We see a lot of the medical records in our phone right now. The HMOs are very advanced, and there's interoperability between hospitals and HMOs. But if we try and envision a really interoperability system with a lot of tools that are more personalized, and it's not just in production, AI tools that will help you. It's also in the research phase. If you want to have federated learning algorithm, if you want to have all the relevant data from all the relevant places, then if you don't have this system in place of open standards, it will never happen. So it's a big investment, and it's an investment for the future, but if you try to vision how the future will be, it will not happen without it. So.
Can I pick up on that and just add a few words? I think that this approach also brings to the table something that we're discussing in data protection circles and in competition circles, which is data portability and the principle of being able to move your data from place to place. And it's been said, let's put the patient in the center and allow patients to be the owners and the movers of their own data. And what the Ministry of Health are introducing is that type of thing firstly, which may improve people's ability to manage their healthcare better, and also to disrupt the system with additional applications, additional developments that are not necessarily part of the HMO systems, but may add additional capabilities that will democratize the digital health for the patients themselves. And I think that could be a real long-term goal, which is very worthy.
And FHIR is international standards. So is there part of an eye on things that are developed then within Israel being more applicable internationally or vice versa, or could that just be a happy accident?
Well, you have to localize the standard. This is why a lot of countries are having a local FHIR community. Everyone wants to do the less changes they need and to comply with the global, but you have to localize it. And at the end of the day, you have a very specific health system in every country that the standards cannot be the same. But we're trying to do it as the same as possible.
Really interesting. Professor Straub, let's come to you. What's the roadblock that you would like to see lifted or you can lift? And if you need more than 12 months, I'll grant it.
Probably it takes more than 12 months. Well, the challenges we are facing is first to motivate our injuries, the person we're giving insurance to download and use the electronic patient record. As I said, there's a slow increase in numbers and people are hesitant, and there are probably two reasons. One is, and that's the second great challenge, as Professor Broich said, we take a very defensive position when it comes to data protection, and it's not a risk-based approach, it's a very in general defensive approach. And this is also widely communicated in the media. So people are hesitant to use the electronic patient record because it's not really clear whether the data is safe and who looks into it and so on. So the two challenges we are facing is motivating our injuries to download and use the electronic patient, work together with the providers, that they are getting linked to the telematics infrastructure. They have to, but they sometimes need some support, and they also need to be convinced to really use it, because only the electronic patient record will be used widely. We will take the advantage. And we have learned during the corona pandemic that if we had the system 2 years ago or 3 years ago, we would know who has been vaccinated, what vaccine has been used. We would be able to analyze who has infections after being vaccinated and so on. We were not able to do it just because the system was not in place. So this is, I would say, our greatest challenge, to get people to use the system which is already there, but it has to be used.
Okay, we have to flip that around because we have to talk about the enabling environment. So how do you incentivize people to do that? Are there any things that you at BARMER can do in order to increase the uptake? Or is that something which is kind of incumbent on changing public dialogue and is beyond the kind of, the reach of solely BARMER?
Well, we are starting now because we didn't start with marketing the electronic patient record before the provider side has been linked with the system, with the telematic infrastructure. So this starts now, and now we are starting, we have all kinds of information materials in print, online, in video formats that help to motivate to use the electronic patient record. But we are, as I said, we are lagging behind a little bit. So we are just starting to market the use of those digital instruments or digital tools.
It's really interesting. Okay, I just want to ask one more point before we give Professor Broich the ability to come in, because you talked about financial compensation or paying for digital apps. And I just wondered whether there's a different model required there, or whether you think the way that we currently pay for pharmaceuticals or devices will translate across, how people are reimbursed.
Okay. So, well, I'm a little bit in a minority position as far as reimbursing those digital health applications is concerned, because I think if you want something to move quickly, and if you want something to develop momentum, you have to pay for it. So I don't care about what we are paying right now for those DGAs, as we call them. But certainly, if the whole thing develops, if those DGAs develop momentum, we will have to talk about how they are reimbursed. Because I'm a doctor myself, a physician, and I would not like to see that the use of the DGA is paid 5 times, 10 times, 15 times as much as I'm being paid as a doctor to taking care of my patients. So I'm sure we have to go into this discussion. We have to start the discussion about how to fairly reimburse those DGAs. But first we have to develop momentum, then we will discuss how to pay for them.
Okay, fantastic. Well, let's
In the
jump
long
to this
run.
side, Professor Broich. In terms of the enabling environment, what are you working on at the moment?
Yeah, I think particularly digital health applications have been a major step forward here in Germany. And as has been mentioned by our minister earlier, I think that was the first time that there was a clear business model to develop such and to get the momentum you are speaking about. And here I'm very optimistic that this will be developed even further. And we heard that other countries will do similar things now. The other thing here in Germany is that we are building up now the health data space and the research data lab with 75 million people's data from statutory health insurance companies. And I think these additional real-world data will be available now, even in Germany, then for research, academic research, not for industry. We have this distinction, and this is criticized by many, but I think this is a major step forward as well. And we are already using machine learning tools in our institution for safety aspects, for instance, of medicinal products and medical devices. And this is a major step forward as well to find such signals much earlier than we did in the past.
It's really
What is going on?
And can I ask, within your organization, have you had to bring in new people in order to look at these new digital products?
Yeah, I think it was the most important thing is the mind change. So in earlier times, regulators have been very conservative, saw themselves only as a gatekeeper and risk avoiding. And today we are seeing us ourselves as enabler, particularly for these new developments. And I think this is very similar to the agency like the FDA is doing today, or our colleagues in Israel now, to be an enabler and to be in front and to discuss very early with industry, with academia, what is the best thing, and to do that as well with insurance companies and the payers. I think everything must be together very early.
Okay, so you mentioned the FDA, and they have been a bit controversial recently in some of their decisions, particularly also on AI tools. How do you kind of navigate that path between creating an enabling environment, but also kind of avoiding some of the kind of situations or comments that the FDA has received?
Yeah, so of course we don't have all the expertise in our house. So we are working together with institutions here in Germany, like the Max Planck Institutes or Fraunhofer institutions, to get this additional then expertise at hand. And of course, we are learning from these experiences otherwise. So I can't promise that we don't make a mistake in the future, but I think we have to do our experiences carefully, clearly, but more optimistic than we did in the past.
And do you think regulators have the standards or, an agreed framework for evaluating new tools, or is that also still?
Well, we are developing the European health data space, and one of the initiatives from the regulators is Darwin, and we are not moving data then to other places, but the questions can be sent out to the different countries, and then the answers will come back from the different data spaces on these questions. And I think this is a special European approach, and this might be helpful for others as well.
Super interesting, thanks. Okay, Ms. Shmerling, Magazanik, your enabler, what would you like to work on or to see others work on?
Well, firstly, I have to, and being a lawyer, this is my nature, I have to state that being the manager of a think tank, I don't really unpack challenges. I just describe what I'm seeing and maybe give some recommendations. But I would say that one thing that we aspire to do is to help policymakers and industry players understand the technology well enough before making policy decisions or regulations. And I think that looking at AI or hearing the buzzword AI, it's good to remember that it's a host of technologies which some have been here, and it's been said even before that it's even an old technology. Some are very new. They're at various states of maturity, various states of implementation. They will look different and will carry benefits and risks that are different in each vertical of society where they're implemented. So I think that it's a bit ambitious to say today that we are able to create AI policies that are relevant to the state of play. So we've recently published an infographic on the spectrum of AI technologies that tries to show these various types of technologies and give them names and start discussing them in more detail and more nuance. And the other thing we started working on is a comparison between the current state of AI ethics policies in different governments or different nations. So we're looking at what's the status currently with the EU draft and Singapore, Korea, Israel, the US, Australia, and we really want to see what type of policies each government is thinking about and how they are going to work together, because at the end of the day, this is something that will be relevant globally and needs to work globally. I think collaborating on these types of policies is crucial. So that's our next step.
Fantastic. Okay, so we're moving towards the end of the panel. We're moving towards the informal part of the meeting. And so I'm going to ask you briefly, all of the people in this last panel, as we go along, to talk about what you would like to learn as we move into the informal part from your counterparts. So what would you, for example, like to learn from the Israeli representatives as we move into perhaps some after-meeting chatter and dinner? So I'll come to you first. What would you like to learn? And in about 30 seconds to 1 minute, if you could.
Yeah, I think the database which is available in Israel, as we have seen that you can online manage a healthcare problem, that is what we are looking for.
Okay, well, the connections are there for you to continue the discussion. Yeah, go ahead.
Yeah, same thing. I would like to learn what the regulatory framework and the technical basis was that you were able to deliver first in the world excellent data on what the pandemic was, how vaccination worked, and so on. This would really be something I would be interested in.
Okay, Mr. Benor.
I think the funding mechanism that DIGA is a very innovative model, and would love to learn how it works in practice and what a lesson learned from that, and think how it could be accommodated to Israel. So that's.
Ms. Shmerling, Magazanik.
I think I'd be really interested in seeing some surveys, statistics about perceptions of German citizens around these questions and issues, and what are their thoughts and positions on the cost-benefit between health and data protection and ethics issues.
Well, that's a super interesting idea to finish on. You know, maybe a survey in each country to identify whether the cultural differences are there or not. So that's the end of the final panel. I'd just like you to join me in thanking the panelists, Mr. Benor, Professor Straub, Ms. Shmerling, Magazanik, and Professor Broich. Okay, if I could ask Carsten, my co-moderator, to join me on the stage. And I think we have to say what we've learned, what our highlights were. So I'm going to go to you first.
Wow, that has been an intense day. So summing that up only in a couple of minutes. Well, I mean, basically what we try to cover, and I think, and please interrupt me or just join me, looking at the three working streams that we're going to cover, they were basically already covered here in today's event. And if we speak about communication and trust, which was, I think, fundamental also for our panel discussions here and for the various pitches we had, I think we can say that there are indeed different types of data, right? So we heard about personalized, anonymized, and also usage data. So when we think about data, this is for sure, when we think about communication and trust, we should keep in mind that we need to better differentiate the different types of data. That was my first lessons learned for today. And second, I would say we spoke about regulation. So what would you say? I mean, this was also the third panel. What did you take away from the area of regulation?
So do you know what I heard when we were talking about regulation is that there's a kind of there's a difference in having a system which is already in place and you're kind of working to improve it and trying to build a system from nothing. And what I heard in terms of regulation and governing the data that's within that is the benefit of having a system which is in place is in place, right? But it's hard then to keep moving forward. However, it's difficult to build a new system. And then when we add regulation onto that, what I heard is it's such an open field. So you are trying to regulate something which is constantly moving, where the decision is not yet made, and there's so many buzzwords. But I think what was really interesting from the second panel was all of the companies are thinking about the tenets of regulation, even though that panel wasn't about regulation. So they talked about privacy, about cybersecurity, about ethics, about demonstrating whether or not something was effective, and that wasn't the panel on regulation. So,
all right, I agree. But I liked to add another buzzword to the long list of buzzwords that we touched today. It wasn't on this, I think on the panel beforehand, was the buzzword RegTech. So regulatory technology, and I think this is definitely something next to a good legal and a solid legal framework that we need in order to cope with the immense and growing issues of digitalization and artificial intelligence. And what shall we note for the last field, so technology in general, as we already touched basing it?
Well, I think that we heard an enormous breadth. I think that we heard quite a lot about the foundational aspects here today, but then we also heard all of these kind of hot topics, this idea of like, you're surprised by this, you're wowed by this combination of cryptography and cybersecurity. So it seems to me that this field of AI is just stretching from some of the kind of really like quite foundational aspects of how do we get everybody's data together, and how do we ensure that we have the regulations in place to make the research needed when we have a pandemic, to literally just like cutting edge technology. How about you?
Well, I couldn't agree more, first of all, to say. And then I think one important point also, I mean, we are designing a program here that crosses borders between Germany and Israel, and that connects people. And we do that in order to find better solutions to connect data. So, right? So, I mean, we spoke also about interoperability or data portability. I also very much like this, one of the last slides where we saw this central information exchange system. So, indeed, this is something we should discuss further in the upcoming time and months and, well, years to come. And hopefully it won't take another 3 years to come up with the best solution for this, but I'm very positive that over time we will use the different formats of the German-Israeli Health Forum Artificial Intelligence to bring together all the experts from the two countries and to support a better regulation, to support indeed more innovative the application of more innovative technology, and last but not least, to find more trust in artificial intelligence, right?
I'm going to let you finish on that, and only as a very interested observer who is honoured to be here today to help you through your event.
Well, it won't be the last time, Naomi.
Just to say, it's been fascinating, and I think what's been particularly interesting is to see the discussions of people when they went for coffee, how certain individuals made a beeline for somebody who'd said something that they heard. And quite often when you have events like this, it's not just what goes on here on the podium, but it's those conversations which make the connections. And above all, when we're talking about health, we're talking about research, we're talking about two countries coming together and individuals building bridges. So with that, I have nothing else to say on the content of the program. program, but we do need to invite some important people up here to the podium.
Absolutely.
Now you're going to ask me who they are. 'Cause this is your bit of the script. Okay, so no, we're joking. We'd like to invite the core teams from both of the ministries to join us up on the podium so that everybody can see who's worked so hard, the core team of ELNET. So please do come up onto the podium because I know that all the attendees would like to thank you.
Obviously also both ministries, please, and give them a warm applause.
So as we move into the informal part of the program, here are the people to ask more questions, here are the people to thank, and please do join me once more in thanking them.
Yes, thank you very much. Naomi, we talked about it already. This is a forum, and a forum lives from the participation. And it's not only what happens here on stage, it's what happens at coffee breaks, what happens tonight at the reception, and what happens especially between the events. And I think for us, it's very important to bring you all together. And I think for us, and also for those which are participating online today, it's important that you see the faces behind the emails, that you know whom to contact if you have an idea, if you want to start a project, a collaboration between Israel and Germany in this very important field of AI and healthcare. Please contact us. We can facilitate your work, we can help, we can build bridges, and that's what we are here for. And we have this 3-year. Today is a kickoff. But I think today is also, we had a lot of talk. And after talking the talk, I think now it's time to walk the walk and walk over to the reception and start collaborating, starting exchanging views and bringing the minds together. Thank you.
Want to give any comments?
Just want to agree. Thank you very much for everyone. And as mentioned before, it's not just government collaborating; it's industry and academy and research and everybody. So, and I think government should be the one who facilitate the conversation and try to help. So please approach us, try to challenge us to do a better job, and thank you very much.
Thanks so much.
Wonderful.
So an in-person approach or a email approach, and that only leaves me to say a couple of final housekeeping points. So I need to tell you that dinner will be this evening. I'm sorry for those of you who are online who won't be there, at the Hotel Amano Grand Central. It is a very short walk from here. It was a beautiful day. So anyone who would like to walk, please do join myself. I'll be walking. Will you be walking? Do join us on the short walk over there because it's really beautiful. However, if you're exhausted, you've worked very hard, well done. There will also be a bus which will leave at 6:15. So,
well, we do have some more minutes for those of you who'd like to take the opportunity to do a picture with your new friends and fellows that you have seen here again or met for the first time in front of our press wall, obviously. And well, maybe one more thing, because I liked what Jens Spahn, Minister Spahn, said earlier on, reflecting on a previous visit of himself, being a member of the Health Committee of the Bundestag to Israel. He basically commented, we should have gone there more often. Indeed, let's do it, and let's now together use the opportunity for the evening reception to, well, spread the word and exchange some more ideas, and then visit Israel more often afterwards.
looking forward to it.
Right. Wonderful.